Okay, so now we are going on to the fishbone diagram. So as you can see here, it shows each little part of the diagram: processes, equipment, people, management, and environment. So we'll start with processes. As you can see, the process, so there's no hard stops on the EHR. So there's nothing that's telling the nurse, hey, this is the wrong patient, this is the wrong, you're doing the wrong thing. There's nothing like that for the nurse to catch the error before it's made. Second check is not performed by the nurse in general, and the five rights are not performed. So, equipment, so there's no scanning or barcode systems in place, so that you have to scan medication, scan the patient, and then give the medication. When that's not involved, that's how a lot of medication errors happen. And then also, labels for medications can be unclear. The nurse has to type it in, they know it by heart, and they give the wrong medication. Nurses are overwhelmed and fatigued with the acuity of patients, which we see every day. That's totally common. A lot of nurses are feeling super fatigued, and that's when mistakes happen, when you're feeling overwhelmed. A lot of times, also, as we know, there's a lot of distractions. You could be pulling a med and somebody's coding, or somebody needs your help doing something, and you just grab what you need and go. And so that's one of the problems. Management, lack of financial support, or adequate equipment. So they're not seeing the reasoning until it's too late, until there's somebody that has passed away from a medication error. Environment, handoff frequently is interrupted, which we know all the time. We try to get through handoff and report as quickly as we possibly can. However, it does happen a lot that we do get interrupted, and some sort of error can be made within that time between the two nurses. Poor communication between healthcare teams. So something about maybe this doctor is saying don't give this anymore, and this one is saying to give this. So you really have to be all together and look at the patient as a whole, as a team. Lack of leadership, this is a pretty obvious one. And time pressures, feeling like you need to get all your medications done in time, or else you're gonna get written up, all lead to medication errors. So these are all the whys and possible reasons why these medication errors are happening.